If you wake up with a dry mouth, every morning your body is warning you about this. Picture this. It's early morning and you're jolted awake, not by an alarm, not by pain, not even a bad dream, just your mouth. It feels like you've stuffed it with chalk, your tongue practically glued to the roof of your mouth. Your lips are parched, like you've trekked through a desert. You think to yourself, not again. If this scene is all too familiar, stick around, because what most people dismiss as just an annoying part of aging is actually your body sending you a crucial warning, and most of us just ignore it. Today we're going to decode that warning, line by line. If you're new here, this channel is all about giving adults, especially those over 60, clear, honest, and research-backed health information. We cut through the noise, connect the dots between those little everyday symptoms and the bigger health picture. No fear-mongering, no clickbait. Today, we start in your mouth, but the story goes much deeper. Before we dive in, hit subscribe. Next week, we're discussing a surprising combination of common supplements that might actually be hindering your body instead of helping it. You won't want to miss that. But for now, let's talk about that dry mouth. Most people don't realize how vital saliva is. It's not just spit. Your body produces over a liter of it daily. Saliva protects your teeth like armor, neutralizes acids that cause decay, kickstarts digestion with enzymes, and fights off infections with antibacterial compounds. It's your first line of defense. So, when this defense system goes offline every night, it's a significant issue, not something to just brush off. Here's what might change your perspective permanently. A major study found that nearly half of adults over 65 experience chronic morning dry mouth. But here's the key insight. In over 80% of those cases, the dry mouth wasn't the main problem. It was a symptom, a signal. Think of a smoke detector. It's not the fire, it's the warning. Morning dry mouth is your body's smoke detector. Today, we'll explore the potential fires it's pointing to. There are 5 main causes we'll cover, and at least one will likely make you pause and think, that could be me. Before we get into the causes, say hello in the comments. Let me know your name and where you're watching from. I read every comment and love knowing who I'm helping. Because number 1, the medication puzzle. The number 1 culprit for morning dry mouth in older adults is often overlooked. It's not a disease or a deficiency, it's the medications in your cabinet. Over 500 prescription and over-the-counter drugs list dry mouth as a side effect. We're talking about blood pressure meds, especially diuretics, allergy pills like antihistamines, antidepressants, bladder control medications, certain painkillers, and even seemingly harmless sleep aids. Individually, they might cause mild dryness. But here's the catch that many miss. When you take 3 or more of these together, the dry mouth effect isn't just additive, it compounds significantly. Studies show that taking 5 or more daily medications nearly doubles the rate of significant dry mouth compared to taking 2 or fewer. And the average American over 65 takes multiple daily prescriptions plus supplements. I had a patient who suffered from severe dry mouth for years, leading to new cavities despite diligent oral care. He brought all his medications and supplements, 6 prescriptions, 3 supplements, and 2 over-the-counter items. Among them, I found 4 known to reduce saliva production. We worked with his doctor to adjust the timing of just 2 medications, not even the dosage. Within 3 weeks, his dry mouth improved drastically. Your action step here: write down every single medication and supplement you take, including common ones like melatonin or ibuprofen. Bring this list to your next appointment and ask your pharmacist specifically, could any combination of these be affecting my saliva production? Pharmacists are incredibly knowledgeable about drug interactions, and this advice is free. Cause number 2, the silent nighttime thief. Pay close attention here, because this affects millions, and most people are unaware they have it. Obstructive sleep apnea. Simply put, during sleep apnea, the soft tissues in your throat collapse, blocking your airway. Your brain triggers a jolt or gasp to reopen it, and you fall back asleep, often without waking consciously. The connection to dry mouth? When your airway is blocked, your body breathes through your mouth. Breathing all night evaporates saliva much faster than nasal breathing, leaving you with that desert mouth feeling. But the dry mouth is the least of the concerns. Untreated sleep apnea significantly increases the risk of stroke, heart rhythm issues, and cardiovascular events. It's also linked to higher rates of cognitive decline. So if dry mouth is waking you and sleep apnea is the cause, it's a major warning sign. How do you know if this applies to you? Ask yourself, do you snore loudly or have strange breathing patterns during sleep? Do you wake up exhausted even after a full night's sleep? Do you get unexplained morning headaches? Do you find yourself dozing off during quiet afternoons? If you have any of these alongside morning dry mouth, talk to your doctor about a sleep study. Many modern studies can be done at home with simple devices, and insurance often covers them. If you're finding this helpful, type the number 2 in the comments to let me know you're getting value. Cause number 3, the blood sugar connection. Let's talk about blood sugar, specifically for those who might have a problem without knowing it. Millions have diabetes, and a significant number are undiagnosed, walking around with elevated blood sugar causing damage without a diagnosis. Here's how high blood sugar leads to dry mouth. Your kidneys work overtime to filter excess sugar, pulling fluid from your body, causing systemic dehydration. Saliva production is often one of the first things affected. Studies show persistent dry mouth is a common symptom in people with poorly managed type 2 diabetes, sometimes for a year or more before diagnosis. Your mouth was warning you, but no one connected the dots. If your morning dry mouth comes with other symptoms, more frequent urination, especially at night, unusual fatigue, slow healing of cuts, or blurry vision, don't wait for your next checkup. Call your doctor this week and ask for a fasting glucose test and an HbA1c. The HbA1c gives a 3-month average of your blood sugar, catching issues your dry mouth has been signaling for months. Cause number 4, the dehydration deception. This one surprises people with its simplicity, but the biology is crucial. Chronic dehydration. You might think, I drink enough water, but hydration works differently as we age. The part of your brain that signals thirst becomes less sensitive. Research shows older adults can be significantly dehydrated without feeling thirsty. Meanwhile, your kidneys become less efficient at conserving water, your skin loses moisture, and if you take diuretics, you're losing even more fluid. The result is widespread, quiet dehydration, with dry mouth often being the only noticeable symptom. The practical fix is simple. Stop waiting to feel thirsty. That signal is unreliable. Build hydration into your day like clockwork, not by feeling. Aim for 6 to 8 glasses of water spread throughout your waking hours. Use phone reminders or keep water bottles handy. Remember, caffeinated drinks and alcohol actually accelerate fluid loss, so they don't count toward your daily intake. If this opened your eyes, share it with someone over 60 experiencing dry mouth who thinks it's just normal aging. A like helps this reach more people who need this vital information. Cause number 5, the overlooked autoimmune condition. This cause generates more undiagnosed cases than almost any other we discuss. If you're a woman over 55, pay special attention. Sjogren's syndrome is an autoimmune condition where your immune system attacks moisture-producing glands, specifically salivary and tear glands. This leads to a body that gradually loses lubrication, causing persistently dry mouth, dry gritty eyes, joint pain, and profound fatigue. Why is this important? 90% of Sjogren's diagnoses occur in women, typically in their late 50s or early 60s. It can take years to get a diagnosis because symptoms like dry mouth or fatigue are often dismissed as normal aging. If your morning dry mouth is accompanied by dry eyes, unexplained joint pain, or disproportionate fatigue, bring up Sjogren's syndrome by name at your next appointment. A simple blood test can screen for it. An early diagnosis changes management significantly. Let's put this all together into an action plan. Step 1. Conduct your medication review. List every prescription, supplement, and over-the-counter product. Take this physical list to your pharmacist or doctor and specifically ask about the impact on saliva production. You might be surprised by what you learn. Step 2. Assess your sleep honestly. For 1 week, track if your mouth was open or closed upon waking, how rested you feel, and ask a sleep partner to note any loud snoring or pauses in breathing. If a pattern emerges, request a sleep study referral. Many are now done at home and covered by insurance. Step 3. Don't skip the blood sugar test. If you haven't had a fasting glucose and HbA1c in the past year, schedule it this week, especially if you have other symptoms I mentioned. Step 4. Restructure your hydration. Aim for at least 8 glasses of water, spread throughout the day by schedule, not by thirst. Keep a log for 2 weeks. Your body will respond. Step 5. Seek immediate nighttime relief while you investigate the root cause. Look for oral rinses or gels containing xylitol, like those designed for dry mouth. Use them right before bed. Critically, avoid mouthwash containing alcohol, as it will worsen dryness. Xylitol products moisturize and protect your teeth. An important note: if you are on blood thinners, lithium, or ACE inhibitors, talk to your doctor before significantly changing your fluid intake, as hydration affects these medications. Also, if your dry mouth is accompanied by difficulty swallowing, pain, white patches in your mouth, or unexplained weight loss, see your physician promptly. These symptoms warrant immediate evaluation. Here's the takeaway. Morning dry mouth is common, but common doesn't mean normal or harmless. Whether it's medications, sleep issues affecting your heart and brain, creeping blood sugar, or an autoimmune condition dismissed. As aging, every one of these can be identified and addressed. You came here with a symptom. You're leaving with a map. Now, I want to hear from you. Drop one word in the comments. Sleep, if you suspect breathing issues. Meds if you're having the medication conversation, or testing if you're booking a blood sugar test. Your input guides what we cover next. If this gave you something your last doctor's appointment didn't, please subscribe. Next week, we're revealing a warning sign that a common cholesterol medication might be doing more harm than good for some adults over 60. It's a crucial topic deserving a thorough answer. Take good care of yourself this week. You've already taken an important step by being here. If this helped you, share it with someone who needs it. You might be doing them a great service.